Hello everyone, now let us discuss about 2023 NM coding guidelines for critical care services in outpatient setting. So what are critical care services? Critical care is a direct delivery by a physician or other qualified healthcare professional of medical care for a critically ill or critically injured patient, hence the term critical care. A critical illness or injury acutely impairs one or more vital organ systems such that there is a high probability of imminent or life-threatening deterioration in the patient's condition. The critical care involves high complexity decision making to assess, manipulate and support vital system functions, to treat single or multiple vital organ system failure and or to prevent the further life-threatening deterioration of the patient's condition. Examples of vital organ system failures include circulatory failure, shock, renal, hepatic, metabolic, and or respiratory failure. Although the critical care typically requires interpretation of multiple physiological parameters and or application of advanced technology, critical care must be provided in life-threatening situations where these elements are not present. So usually the critical care requires interpretation of multiple physiological parameters and application of advanced technology. But critical care must be provided in life-threatening situations whenever these parameters are not available also. The critical care services may be provided on multiple days. They may extend to multiple days and the timeline may vary. They can be provided on multiple days even if no changes are made in the treatment tendered to the patient, provided the patient condition continues to require the level of attention described above. And providing medical care to a critically ill or injured or post-operative patient qualifies as a critical care service only if both the illness or injury and the treatment being provided met the above requirements. They are considered as critical care only if they meet the above requirements. And the critical care is usually but not always given in a critical care area such as coronary care unit or respiratory care unit or emergency care facilities. And the inpatient critical care services provided to infants 29 days, that is the infant must be 29 days and up to 71 months of age, are reported with pediatric critical care codes which come under the category 994712 to 99476. That we are not discussing in this session. We will talk about the pediatric critical care codes in the next session. The pediatric critical care codes are reported as long as the infant or young child qualifies for critical care services during the hospital stay. And the patient must be up to 71 months of age in order to report the pediatric critical care codes. And the inpatient critical care services provided to neonates, that is 25 days age or younger, are reported with neonatal critical care codes that come under the category 99468 to 99469. This also we are not discussing here. So there are different scenarios in case of critical care. Pediatric critical care codes, neonatal critical care codes. And the neonatal critical care codes are reported as long as the neonate qualifies the critical care services during the hospital stay through the 28th postnatal day. That is, the neonate must be 28 days or younger. And reporting of pediatric and neonatal critical care services is not based on the time or type of unit. For example, pediatric or neonatal critical care unit. And it is not dependent upon the type of physician or qualified healthcare professional delivering the care. And to report the critical care services provided in the outpatient setting, for example, emergency department or office, and for infants up through 71 months of age, that is who are greater than 70 months of age, you can quote 99291 and 99292. One more important point is if the same individual provides critical care services for neonat or pediatric patient in both the outpatient and inpatient setting on the same day, report only the appropriate neonatal or pediatric critical care codes that come under the category 99468 to 99472 for all critical care services provided on that day. That implies if both outpatient and inpatient setting critical care is provided, you need to go for inpatient setting critical care only. That is the codes under the category 99468 to 99472. And one more important point is you can also report 99291 to 99292 for neonatal or pediatric critical care services provided by the individual providing critical care at one facility but transferring the patient to another facility. So whenever the physician is providing critical care at one facility, let us suppose outpatient facility, and he is transferring the patient to another facility, then also you can report 99291 to 99292, either code. And critical care services provided by second individual at a different specialty not reporting a per day neonatal or pediatric critical care can be reported by the codes 99291 and 292. The second individual or the second physician of different specialty, provided if he is not billing on the same day either the neonatal or pediatric critical care code, then you can report 99291 and 99292 to the second provider also. And he should not be billing the either neonatal or pediatric critical care for that particular day. And for additional instructions on reporting these services, we need to refer the neonatal and pediatric critical care section, codes 99468 to 99476. This we'll discuss in the next session. And services for a patient who is not critically ill but happens to be in critical care unit are reported using the appropriate E&M codes. This is important. Services for a patient who is not critically ill but happens to be in a critical care unit. He is not critically ill but he is present in critical care unit. Then you can report using other appropriate E&M codes. Now the various critical care services are outpatient setting and inpatient critical care services. Outpatient settings are for adults or infants after 71 months old. The codes are 99291 and this is an add-on code 99292. These two we will discuss in this session. Now coming to inpatient critical care services. For 29 days through 71 months. From infants after 29 days up to 71 months, you need to report the codes 99471 to 99476. And for neonates who are 28 days or younger, you need to report 99468 and 99469. This we will discuss in next session. Now, critical care and other E&M services may be provided to same patient on same day by the same individual. And for reporting by professionals, the following services are included in critical care when performed during the critical care period. Certain diagnostic procedures are included in the critical care services. They are interpretation of cardiac output measures 93598, chest x-rays 71045 and 71046, pulse oximetry services which come under the category 94760, 94761 and 94762, blood gases and collection and interpretation of physiological data. Example ECGs, blood pressures, hematologic data, they are also included. Gastric intubation which come under the category 43752, 43753. Temporary transcutaneous spacing which comes under 92953. Ventilatory management which comes under 94002 to 94004, 94660, 94662. Vascular access procedures 36000, 36410, 36415, 36591 and 36000. This code is repeated. Services performed that are not included in this listing should be reported separately. So all these codes are included in the critical care services and they should not be reported separately whenever performed on a critical care patient. We should not quote these codes, and which are not included here. The services which are not included here should be reported separately, and facilities may report the above services separately. Critical care units, you should not report these things. Other facilities may report the above services separately. But whenever the patient is undergoing critical care, all these diagnostic procedures are included in the critical care services and they should not be coded separately. Now codes 99291 and 292 should be reported for the attendance during the transport of critically ill or critically injured patient older than 24 months of age to or from a facility or hospital. Whenever you are transporting a critically ill patient or injured patient older than 24 months of age to or from a facility or a hospital, then you need to report the codes 99291 and 99292. And for transport services of critically ill or critically injured pediatric patients 24 months of age or younger, you need to refer 99466 and 99467. And the codes 99291 and 292 are used to report the total duration of time spent in a provision of critical care services to a critically ill or critically injured patient, even if the time spent providing the care on the date is not continuous. The time spent might not be continuous. That is, 1 hour he might provide the critical care services, again the physician may go in rounds, and again after 4-5 hours he may come and give some more critical care services. So the time is not continuous, but you need to calculate the exact time that is spent providing the critical care services. And for any given period of time spent providing a critical care service, the individual must devote his or her full attention to the patient, therefore cannot provide services to another patient during the same period of time. Physician cannot bill critical care services to another patient during the same period of time because he must devote his full attention, his or her full attention to the patient. Now, time spent with the individual patient should be recorded in the patient's record. This is important. And the time that can be reported as critical care is the time spent engaged in work directly related to the individual's patient care, whether that time was spent at the immediate bedside or elsewhere on the floor or unit. It is immaterial. For example, the time spent on the unit or at the nursing station on the floor, reviewing the test results or imaging studies, discussing the critically ill patient's care with other medical staff, or documenting critical care services in the medical record would be reported as critical care. So the time spent in all these cases is considered as critical care, even though it does not occur at the bedside. Also, when the patient is unable or lacks the capacity to participate in the discussion, the time spent on the floor or unit with family members or surrogate discussion makers, obtaining a medical history, reviewing the patient's condition or prognosis, or discussing the treatment or limitation of the treatment, may be reported as critical care. Whenever the patient is unable or lacks the capacity to participate in discussion, the time spent discussing with family members can also be considered as critical care time, provided that conversation bears directly on the management of the patient. Time spent in activities that occur outside the unit or off the floor. That is, example, telephone calls when taken at home, in the office or elsewhere in the hospital may not be reported as critical care services since the individual is not immediately available to the patient. So the time spent in activities that occur outside the unit or off the floor are not considered as critical care because the physician is not immediately available to the patient. And the time spent in activities that do not directly contribute to the treatment of the patient may not be reported as critical care, even if they are performed in critical care unit. For example, participation in administrative meetings or telephone calls to discuss other patients. And the time spent performing separate reportable procedures or services should not be included in the time reported as critical care. These are the various points that must be taken into consideration whenever we report the time for critical care in the patient record. And the code 99291 is used to report the first 30 to 74 minutes of critical care on a given data. It should be used only once per date even if the time spent by the individual is not continuous on that date. You can report only one code of 99291 per day. And critical care of less than 30 minutes total duration on a given date. Critical care of less than 30 minutes total duration on a given date should be reported with an appropriate E&M code. Next code 99292 is an add-on code that is used to report additional block of time up to 30 minutes each beyond the first 74 minutes. The following example illustrates the correct reporting of critical care services. This is the time and number of units that must be reported. Here you can see the total duration of critical care codes. If it is less than 30 minutes, you need to assign appropriate E&M codes. If it is the first 30 to 74 minutes, that is first 1 hour 14 minutes, from 30 minutes to 1 hour 14 minutes, you can report 1 unit of 99291. And from 74 to 104 minutes, that is 1 hour 15 minutes to 1 hour 44 minutes. For the first 74 minutes, you need to report this unit, 1 unit of 99291. And per day, only 1 unit of 99291 can be coded. That is also important. For one calendar day, only 1 unit of 99291 can be reported. So from 1 hour 15 minutes to 1 hour 44 minutes, you need to report 1 unit of 99291 and 1 unit of 99292. This is for additional 30 minutes. Next, from 105 minutes to 134 minutes, you need to report 99291, 1 unit of 99291 for first 74 minutes. And for the remaining time period, you need to report 2 units of 99292, that is for 134 minutes, from 105 minutes to 134 minutes. The next is 135 minutes to 164 minutes. For first 74 minutes, you need to report 99291, 1 unit of 99291. And additionally, you need to report 3 units of 99292. The next is 164 minutes to 194 minutes. That is from 2 hours 45 minutes to 3 hours 14 minutes. For first 74 minutes, you need to report 1 unit of 99291. And after that, additionally, you need to report 4 units of 99292. And for 195 minutes or longer, you need to report 99291 and 99292 as appropriate. 1 unit of 99291 and additionally, depending upon the time, you need to report add-on units for 99292. Now coming to the codes for critical care evaluation and management. The first code is 99291. Critical care evaluation and management of a critically ill or critically injured patient, first 30 to 74 minutes. Let us see examples. First hour, that is 60 minutes. First hour of critical care of a 13-year-old with hypovolemic shock secondary to diarrhea and dehydration. Here you need to report 1 unit of 99291. The next, first hour, that is 60 minutes, first hour of critical care of 13-year-old with respiratory failure secondary to pneumocystis carni pneumonia. Respiratory failure due to pneumonia for first hour of critical care, that is 60 minutes of critical care. Here also you need to report 1 unit of 99291. The next code is 99292. This is an add-on code and it should not be used alone. It must be always reported along with the primary service. That is, it must be reported along with 99291. This is reported for each additional 30 minutes. Let us see the previous examples only, but with a greater critical time. So the first one is 90 minutes of critical care of a 13-year-old with hypovolemic shock secondary to diarrhea and dehydration. Here the total critical care time is 90 minutes. So for first 74 minutes, you need to report 1 unit of 99291. And after that, for the remaining time, you need to report 1 unit for 99292. Up to 30 minutes for additionally for each 30 minutes. Next example, 120 minutes of critical care of 13-year-old with respiratory failure secondary to pneumocystis carni pneumonia. Here for the first 74 minutes you need to report with 1 unit of 99291. And after that, for the additional time you need to report 2 units of 99292. Thank you for watching. Please subscribe for further videos on medical coding and CPC training.